Good afternoon and welcome to the Small Business Briefing. It is Thursday, August 19th, and this briefing is brought to you by Marana Group, a data documents and distribution services company in Portage, Michigan. If you need data documents and distribution solutions, I advise you to check them out at maranagroup.com. I'm Rob Fowler, the CEO of SBAM, and Brian Calley is president of SBAM. Brian, the kind of news that caught my eye is that there's a new retail leader in the country. It is no longer Walmart.
Yeah, it's so for the first time in a long time, in the last quarter, there's a new top of the list in terms of volume, and that's Amazon. And I don't think that'll probably be a big surprise to a lot of people. It's actually top in the world outside of China. So there's like in China and then the rest of the world, and so Amazon overtook Walmart to be number one, and that's a big move. I think that it was something that was probably going to happen anyway, but was accelerated by the pandemic. So Amazon is one of those entities where just the nature of the pandemic, the government actions, the changes in consumer behavior throughout the pandemic, they were just perfectly positioned for, and you see it coming out in you see it showing up in their numbers. So we know from our standpoint, you got major retailers, you've got players like Amazon, you got the locals and the locally sourced. One of our friends of small business here locally is Meyer, who goes way out of their way to make sure that they have more locally sourced items than any other retailer. But most retailers the big ones don't do what Meyer does. And so having Amazon, it puts kind of that center, that nexus, like further away from small members, and that's the small businesses. So it is troubling to see it trend that way. But as I opened, it was a trend that was already in the works. It was probably just a matter of time before they overtook Walmart.
Well, certainly you see the presence of Amazon much more, visibly with trucks and boxes on front doorsteps in a way that I don't think I did before the pandemic. So that's not surprising, but it's probably not great news for small business either. So, all right, we have been talking about the employee retention tax credit and just trying to get it on the radar screen of small businesses. We've asked Jamie LaPiccolo. If you've been watching this briefing, Jamie is with Capcore Professional Advisors, and he's been kind of our go-to guy when it comes to navigating this thing from a tax standpoint. Jamie, welcome. And would you just kind of remind us what this employee retention tax credit is and how?
Yeah, good afternoon, guys. Glad to be with you again. So the ERC or ERTC or employee retention credit, however you want to call it, is a credit given to the employers to exactly that, is to help them pay or reimburse for wages to retain the certain employees, full-time employees during the pandemic time period. It originally started out just to be a 2020 credit. It's gone through a couple changes since then with the various bills that have passed. Now it turns into a 2021 credit. And really what it basically says is for 2020 that will reimburse, essentially that the government will reimburse you for up to 50% of the wages that you pay your employees that meet certain circumstances, qualified wages, up to $5,000 of a credit, so $10,000 in wages to certain people, and if you met certain conditions. In 2020, either you had to be shut down under government order, or you had to experience what they called significant reduction in gross receipts on a quarter over quarter basis. In 2020, that was a 50% reduction. So it came a little hard for a lot of businesses to get there, possibly. But if you had significant, and then in the bill that was passed in December, the families, one of the acts that was passed, they They went ahead and expanded that credit to 2021. They made it a 70% credit per employee per quarter. So instead of being just $5,000 in 2020, it turned out to be $7,000 per quarter. Multiply that by 4 quarters, possibly up to $28,000 in savings, and you only had to have a 20% decrease in gross receipts. So it became a significant amount of money to go after. And then really what had happened that really changed the landscape of this whole thing is prior to the December law, you could either pick the ERC or the PPP. Well, the PPP was a lot easier to get and ultimately would have resulted in a lot more money. They then came back and said, well, now what you can do is you can pick your wages, and as long as you're not using those same wages for forgiveness, you can then use them for the ERC. So now all of a sudden, this opened the door to a lot of employers being able to go back and claim credit for those wages that because remember, the PPP, they opened it up where you've got a full 24 weeks worth of wages, and now it's kind of pick your wages and which one you want it to go for. So now this was just extra money that most employers should go back after and get.
So Jimmy, maybe on the on the qualification end, and I think that's a lot of those watching have heard a little bit about this, and okay, there are certain qualifications now that we know that having received the Paycheck Protection Program doesn't mean you're disqualified from getting the employee tax credit or the retention or the ERTC employee retention.
Whatever, ERC is the easiest one. Is one I go by.
So now it's at 20% loss in sales in that quarter. But is that compared to the same quarter?
So they're all compared to 2019.
Okay.
So they're all going to be compared to 2019, and the other beauty is that you can use what they call their safe harbor, which means that I can look at the quarter preceding the quarter to determine the following quarter. So for example, because some of this credit was designed to be live, meaning that you were supposed to be able to use it against current wages and get that credit back against current payroll tax deposits. So, but the only way to do that is you had to determine that you had a loss in a quarter of 20%. So theoretically, employers could go back now, look to see if they have a decrease in second quarter of 2021 compared to 19. And if they meet that 20%, then they can start using it for the third quarter. So they could start doing it now and getting that money back now. If you choose not to, then what you have to do is you have to go through the amendment process and amend your 941 and so forth to claim that refund. And the benefit of doing it now versus doing the amendment style is most people, or some people, if you're using a payroll service or what have you, is you get the money now and it's all filed electronically. What we're starting to see is if you're amending, the IRS has no way of accepting that amendment electronically. And so now you're thrown into basically the snafu that is the IRS's mail system, which I think you've read in the news or heard that is severely behind in processing. And we're advising clients that it could take 6 to 9 months to get this money back if you go back and amend.
Wow.
Yeah.
Yeah, so that's a good motivation but it's fast. I mean, it would be faster anyway, even if they weren't behind.
Yeah.
To do it real time is so just we kind of look for rules of thumb, if you will.
Sure.
So if you're a small business, you got the Paycheck Protection Program. If you have a quarter where you were at least compared to the 2019 corresponding quarter, you've lost 20% or more. This is big money. I mean, you need to get with your accountant and see what you qualify for.
Yeah, I mean, if you do the simple math, let's assume that the average employer, average SBAM, listener is 5 employees, and you've got a 5 or 7, that's $25,000 to $35,000 potentially that's out there for the quarter. That's enough money to get them by for a few weeks or whatever. So, I mean, it's something not to just blow by. You need to get with your tax preparer and see if you qualify. The only caveat, Brian, and I don't think this got a lot of a lot of play relative to this is this definition of qualified wages. And the IRS has now issued final guidance on the fact that those owners that are 50% or more and their related relatives don't qualify as wages. So if you've got a mom and pop operation, it's truly mom, pop, and brother, sister, then they're not going to have any qualified wages under the current guidance. I don't think it's fair. I don't think it's the intention of the law, and we're hoping Congress is going to make some changes, but it is what it is right now. And, take it in, I've talked to other professionals about this, and they've reminded all of us that keep in mind, IRS guidance is just that, it's guidance, not law. So, but, we know where they're going to come down for.
So one follow-up on that, Jamie. So let's say that, that somebody had the Paycheck Protection Program. Is it possible to go back and change which wages applied to the Paycheck Protection Program to kind of free it up that way?
Yeah, I mean, you run into a little bit of a hiccup with this. In theory, yes. You run into a little bit of a hiccup depending on the application that they've submitted. So you run into, and we've talked about this with I've talked about this with other CPAs and so forth, is let's assume, and I'm going to just use rough numbers, let's assume that you had $100,000 PPP and you reported on the application that you only had $100,000 in wages, then those wages that you put on the application to get for forgiveness are not eligible for it. Okay, and then if that's the only wages that you paid during the period, then you may not qualify for the ERC because that's all the wages you had to get the forgiveness. But let's assume that you had that same $100,000, you reported $250,000 of wages. Well, only 100 is needed for the forgiveness. That extra 150 can be used in the ERC calculation. Assume that those were paid during the qualified periods of the ERC. So it gets to become, and I hate to say this, it gets to become a little bit of a puzzle of, and literally when I work with my clients, literally I spread out their employee wages down on one side and per pay period across this side on an Excel, and we start highlighting which wages we're going to use for what program to make sure that we've maximized forgiveness and we're still maximizing the ERC. So it becomes a little bit of a challenge, and even common sense wise, assume that people got the 2021 PPP2, they would have received that PP2 in January, maybe February. That's when they were rolling that out. Most likely because of the 24-week period, and if they maintain the same employee structure throughout, they could claim the ERC for all of the first quarter and then switch over to the PPP in the second quarter, because they would have enough wages to get that forgiveness. Because again, you borrowed on 8.5 weeks, but you have 24 weeks to generate payroll. So there's still a good chance that you could get it from there, or vice versa. So you just have to kind of do a little bit of calculations.
All right.
So one of the things I think we're trying to do, Jamie, is just not to make everybody an expert on this, because this really is between them and their tax preparer, but sort of get it conceptually that this could be a lot of money, and they can think about the likelihood of them being eligible for it. So appreciate you kind of laying it out there in plain English.
Yeah, anytime, and it's you're right, Rob. I've got clients that are getting $75,000 back. Yeah, it's just it's silly, it's go after it while it's there.
Yeah. All right.
All right,
thank
guys.
you, Jamie. Appreciate it. By the way,
all right, always good to be with you guys. Have a good one.
Yeah, appreciate it.
Yep.
We have just put put a link to a document that we prepared along with the Michigan CPA Society, and Jamie was one of the contributors to that, about the employee retention tax credit. So you can check that out. Brian, let's sort of get back a little bit to vaccinations. We've been talking a lot about this. We're told now that booster shots are recommended and coming probably in September. I think it puts us in a whole new area of what is the definition of fully vaccinated.
Yeah, it's going to have big ramifications on a whole bunch of other things that are stirring out there right now in terms of who's mandating and how much are they mandating, and is that going to apply to boosters and so forth. But let's set that aside for a moment and just talk about what's on the table. So the FDA is going to approve, and the CDC is going to recommend a third booster shot for the RNA vaccines, the Pfizer vaccine and Moderna vaccine. And the standard that they purportedly will be putting out next month is to is to wait 8 months. So 8 months after you received your second shot, then you would get a booster. But even on that point, is it after your first shot or second shot, or is it going to be followed that closely? I don't know. Here's the other thing is even what they have out now, which is to say that if you're immunocompromised and you could get a booster shot right now. This is based on the Israeli study that showed that it did improve protection for those that had, especially for those that had shots at the beginning of the year. So we know all those things are coming, but we also see happening all across the landscape and including in some places here in Michigan are different requirements. So it might be healthcare. We talked before, Spectrum is requiring vaccinations of its staff, and then also vendors that deal with that enter onto their properties. We've seen like the University of Michigan requiring it of their students and their faculty. When you add a booster into the mix, what are they going to do with that? Is there now a booster requirement? So I think there will be kind of a ripple effect on this that is going to have to be worked out. And there's plenty of legal action that's happening. There are legislative proposals. I mean, it's the amount of fight around these issues, I think, is really just getting started.
Yeah, that is going to be something to watch long after this pandemic is over, is the rights and responsibilities of individuals, businesses, and the government. We've talked some about the fact that, just trend-wise, it seems like we're going backwards a little bit. CDC recommendation on masking inside, even for vaccinated people, what businesses are doing in response to that. You and I have had a chance to sort of sit in on a conversation, if you will, of business owners who are implementing new masking strategies. Seems like we're kind of going backwards.
Yeah, there's definitely a trend in moving back to adding in different safety precautions. We know that some of the things that were in the beginning, things like deep cleaning, remember when that was like a big thing, and we know that surface to surface transmission is just not the way that this virus works. So thankfully, those things don't appear to be coming back. But when it comes to like masks, requirement of masks, the CDC changed their guidance. There really wasn't a big immediate response, but as you saw the Delta variant kind of take over across the country, especially in those states with low vaccination rates and hospitals starting to fill up, the percentage of ICU beds that are taken up right now is quite high. And as you started to see those things rise, not surprisingly, different institutions, starting with healthcare and then kind of moving into, you saw some university and government, and then the state of Michigan itself for its employees requiring masking inside when distance can't be maintained. At the same time, we saw kind of what started as a trickle and now a pretty substantial increase in the number of private sector businesses responding in the same way. And I think there's a lot of things at play there. They know that workplace safety, while it doesn't have specific rules, the guidance that we gave before is there's a lot of approaches you could take. The only one that we would not, we would definitely recommend against is doing nothing. You want to be able to say, here are the steps that we're taking. It could be a lot of different things that you could do, but COVID is a recognized hazard. You need to have a response or an answer to it, and we see that happening now more and more. So employers are responding to the increased risks and making adjustments. Some have kind of dusted off the old preparedness and response plan and updating it now for the new realities and putting them back in place. And I think that's a smart move. In some cases, it's just being responsive to what the employees want. That's always important, of course, but also to protect yourself from regulator interference, potential penalties, fines that might come with complaints again, if you get that call and they say, what is it that you're doing to provide a safe workplace? And you say, well, with respect to COVID, nothing. That's that. And here's the other thing is I've actually had multiple conversations just trying to understand, is there anything in the works right now? And in terms of like rules and across the board. And I'm really not picking up on it. There seems, at least at this point, a determination to say, everybody knows what they're supposed to do. Everybody knows the things, the recommendations. We've been hearing these things for a long time, and people are going to do them or they're not. So there is a consistent reluctance to issue new kind of statewide mandates. And so it really is being, at this point, still being left up to individual business owners or boards or whoever controls a particular the policies in a particular location to decide for themselves.
One of our partners is the American Society of Employers, and they have done, so it gives us some more further insight, I suppose, as to what businesses are doing, how they're responding to this. Some interesting insight.
Yeah, so ASE did a survey, and it had some interesting insights. It actually matched up pretty well with the anecdotes that we were seeing, which usually they do. We have 28,000 members. Our anecdotes pile up. They are kind of like statistics in a lot of ways. But anyway, it was about 30% said the recent increase in COVID-19 infections had resulted in them changing their organization's pandemic preparedness and response approach. So, about a third had made some changes with respect to that. Keep in mind, some never let go of the old. So it's not that a third are doing something and the other 2/3 are doing nothing. Some businesses never stop doing safety precautions. A majority of those surveyed, 74%, a little more than 74%, will continue to encourage vaccinations but not mandate them. There 16% said they were considering a vaccine mandate within their workforce. The very few employers would require or do require a proof of vaccination for in-person work. Only 13% there said they would even consider such a step. Again, not a surprise. I mean, those that there's a lot of education, work, here's the information, encourage you, recommend that you do it. But the idea of going so far as to require it is something that that most small businesses haven't done and are not going to do. Remote work, 36% stated that all or most employees have fully returned to the office. So a little over a third have largely returned to the office. Another 27% have implemented a more staggered approach. Actually, that's where we're at. Some have made a return to the office and a hybrid schedule. Others are still fully remote. And about 42% surveyed, almost 43% require face coverings at work. Another 27% are considering adding face coverings at work. So to me, it's not going to be a surprise if you see that workplace face coverings will become the norm over the next month or so among businesses with or without a government mandate. And remember, here's the other thing, another kind of issue that, one of the fights from last year that we just couldn't, with the business community united, we couldn't win on, is there are no liability protections for businesses. There's some built in, our system, the way our system works, I think is one where objective evidence is required to lose a lawsuit, but we don't have any built-in, we don't have any explicit liability protections for somebody who says, hey, I got sick at your location. And so naturally, business owners are going to want to be able to point to it if they get accused, if they have an outbreak, if they have somebody says, hey, I got sick, I had serious consequences, or somebody I love did, and therefore it's your fault. There isn't, the only defense that a business owner would have now is I had safety precautions in place.
Well, it is interesting to see how the government can actually leverage businesses and even other governments, if you will, by saying, you don't have to have a mask mandate, but if you don't, For example, in Kent County, the health department has said to the schools, if you don't have to have a mask mandate, but if you have an outbreak, all the kids who are unmasked will have to do a 10-day quarantine as a sort of a lever. I thought there was an interesting one. The Biden administration now has come out with a way to leverage nursing homes to have their employees vaccinated. It's a pretty big hammer.
It really is. This one was kind of put me on my heels a little bit. I mean, the idea that the federal government would say, okay, nursing homes, if you have employees that are not vaccinated, you can't get Medicare or Medicaid dollars. Now, it wouldn't surprise me if people don't know this, but the vast majority of nursing homes are paid for by Medicaid dollars. Medicaid dollars is by far the biggest payer of nursing home services, and so that's a big hammer. Now, nursing homes have traditionally had a hard time staffing up. It puts them in a really tough spot because on the one hand, they cannot afford to have the federal government say, no, you're not going to get reimbursed for your services because you have some of your staff that is not vaccinated. And at the same time, if the business, the nursing home itself is not able to staff up without those individuals, then they're in between a rock and a hard place. So that's one of the things that are out there that I think it's going to be a pretty dramatic process, because nursing home employees have proven to be actually quite a pretty high proportion that are not interested in being vaccinated. And even from the breakthrough cases, remember the average, if there's only 2% of all deaths since April 1st are unvaccinated people, even though that only makes up 29% of the population. So, that even though that's 71%, sorry, of the population, but the average age was 82. So the breakthrough cases in connection with being elderly is still a risk, even if vaccinated, at least more so than younger people. Works the same way essentially. So it's not that there's no logic behind saying, hey, nursing homes, you really need to go the extra mile here. But nursing homes are already notoriously have a hard time staying fully staffed. And so I think this is going to be a really tough challenge for them. And then their vendors. Nursing homes use vendors for things that happen in their nursing homes. And I just think that there's going to be a long tail to this one in terms of the disruption and nursing home. People that own and operate nursing homes are going to have to pick between bad options. Like, it's not going to be, here's the good option, we mandate it and everybody just does it. I think the trade-offs here are both potentially have some pretty serious consequences.
Yeah, it's interesting how creative sometimes government agencies at different levels can get at trying to leverage people into doing what they want. I've been fascinated by New York City, where the city government has essentially said you have to have a vaccine to eat in a restaurant in New York City, and to do some other things. And the small business has to actually see your vaccine card, your passport, or they can't let you in. And if they do, they'll be in trouble. A group of small businesses in New York City have had enough of it, and they are suing New York City over this.
Yeah, this will be a pretty interesting lawsuit to follow. The lawsuit itself, it really zeroes in, and the broad policy, and does the city really have the authority to limit it in this way? But also, they're going after the lack of accommodation. So what they're saying is there are some people that, and it's not a large number, but there are some people that can't receive a vaccine for specific medical exceptions. The New York City policy does not address that. And so they're saying that makes this policy illegal. They're saying there's no provision for the religious exemptions that are in law, and therefore the policy is invalid for that reason. I mean, they go through a pretty a pretty robust legal argument. Now, this is in state court, so however they decide there is not going to have direct ramifications in Michigan, but it is an interesting lawsuit, and one where they set a rule and they say, okay, businesses, you're the police on this one. And the businesses are saying, not only do we not want to be the police on this, but we don't want you to tell us who our customers may be. And let us decide who and take on the risk either way, and what customers that we serve. And so this will be one to watch. It's no direct ramifications here in Michigan, but one that I think will still be instructional in terms of how it's viewed in a legal process, where facts and some federal rules are part of these facts that are applied and compared against such a policy.
Well, and while I don't know of any cities who've done the same thing, it is the city of New York City has basically said if they got a 70% vaccination population, that restaurants are restricted by 30%. It's just a different way of doing a capacity limitation, and again, leverage is what they're after, but the small business is the one really hurt by it.
Yeah, and that's what we've seen in a bunch of cases here, is that people that they might have good intentions, and I think I'm willing to give most people the benefit of the doubt that they're doing what they think is right, but time and time again, what we're seeing is that the actions that are taken, or the normal response, is putting small businesses in a more difficult position, one that was more difficult to be successful, to survive, to grow, and also in some cases, like, let's go all the way back around to the very beginning of this conversation, actually pushing business to the big players, like Amazon. So this is very much something where small business, time and time again, has been collateral damage.
Well, on that happy note, that is what we have for you today. Thanks for joining us at the Small Business Briefing. We'll be back on Monday with the next version at 3 o'clock. There is a owner-to-owner meeting in Lansing, Michigan tonight, live. If you happen to be around in about a half an hour, it'll start at Michigan. This is what we do only for small business owners. You got to be a small business owner to be in the room, and there's one tonight. Maybe we'll see you there.
All right. See you on Monday. We're going to have all the numbers updated for you then.